COVID cases still on the rise. The tourism minister defends new travel policies, and a Grand Bahama MP's unbothered about his nomination in the next general election. Good evening, everyone. I'm Leah Cooper with your JCN News for this Thursday, April 22nd. Total COVID-19 cases in the Bahamas nearly 10,000, with health officials confirming an additional 58 new cases on Wednesday, April 21st. In the Ministry of Health's latest update, 42 cases were confirmed on New Providence, 11 on Grand Bahama, 2 on Bimini and Cat Key, 1 each on Abaco, Exuma, and Andros. These cases push the total case count 74 cases shy of 10,000 at 9,926. A further breakdown of the cases indicates that 22 males and 36 are female. Active cases are now at 504. 50 of them in hospital, 4 in the intensive care unit at Doctors Hospital, while 10 cases were considered moderately ill. 18 cases remain at Princess Margaret Hospital, all considered moderately ill. 6 considered moderately ill are at the South Beach Acute Care Center, and 12 over on Grand Bahama at the Grand Bahama Health Services are also considered moderately ill. On the flip side, 18 cases recovered on Wednesday, pushing the total there to 9,158. Some 408 tests were completed on the same day, 344 negative results. 4 were repeated tests and 2 had inconclusive results. The COVID death toll remains at 194, with 26 deaths under investigation. To date, 83,696 COVID tests have been completed. And a spike in cases at the Princess Margaret Hospital has resulted in adjustments to hospital operations. The Public Hospitals Authority releasing a statement confirming that PMH is experiencing a spike in COVID-19 cases requiring admission. As a result, measures have been taken to manage the increase in cases, including the discharge of patients who meet the criteria for discharge and the temporary suspension of in-person clinics. The hospital has now reverted to the telehealth/virtual platform for outpatient clinics. Those patients needing to reschedule clinic appointments or patients with new referrals who require an appointment are asked to 1. Email a copy of your referral to appointments@pmh.pmhbahamas.org. 2. Send a clear photo of your referral form to 808-9972 via WhatsApp or SMS. Or 3. Contact the PMH Appointment Scheduling Unit for more assistance at 808-9972. Outpatient phlebotomy services at PMH, commonly referred to as lab services or Door 10, is closed. Patients requiring lab work for outpatient appointments are asked to use lab services at PMH Agape Clinic or Family Medicine Clinic at 4th Terrace, Centerville. Further, dental services have been suspended, but dialysis unit services remain uninterrupted. However, that's appointment only. The PHA is reminding that only emergency cases are encouraged to utilize the emergency department at the Princess Margaret Hospital. Non-emergency patients are asked to contact their primary care physician or utilize community clinics for care. A medical emergency is an acute injury or illness that poses an immediate risk to a person's life or long-term health, sometimes referred to as a situation risking life or limb. If you are unsure whether you require emergency medical assistance, please call 919 or the emergency department at Princess Margaret Hospital at 326-7014. The Minister of Tourism says there's huge benefits getting fully vaccinated. Our Laurencia Smith has more.
The minister noting that the government is simply piggybacking off the Centers for Disease Control's guidelines relating to fully vaccinated people who have passed the 2-week immunity period in the U.S. One part of the travel incentive is that as of May 1st, international travelers will be exempted from COVID-19 testing once they have received their 2 doses of the vaccine.
Right now we have a regime in place where you have to get a PCR test 5 days prior to arrival in the Bahamas. You have to pay for and go online and get a visa. And what we're finding is the PCR test 5 days prior to arrival is causing a lot of stress. What is happening is that persons go and get the test. They have to wait for the results. They have to upload it onto the site. They have to wait for us to respond to them. And all of this is causing a lot of consternation to travel. And we feel that once you get the vaccine, the need to go through all of this bureaucracy, for lack of a better word, in order to enter the country, will make the Bahamas an attractive destination.
On Wednesday, the U.S. Embassy issued a Level 4 travel to the Bahamas. In the statement, the embassy noted that following this update, about 80% of the countries worldwide will have a travel advisory of Level 4.
A large proportion of persons. And, you know, the country that is not in Level 4, and clearly they're not going to put it in Level 4, is the United States. I mean, they're far worse than we are. So if you're traveling from the United States to the Bahamas and you're looking at their level of COVID compared to our level of COVID, our country is way safer than theirs. And 93% of our foreign visitors come from, presently, this is with after COVID, come from the United States to the Bahamas. So we feel that, you know, certainly the removal of the PCR test and the acceptance of the vaccine will help us in our climb back to what we used to be at.
Now, two of the country's major markets, Canada and the United Kingdom, suspended flights into the country due to the COVID-19 numbers here between late 2020 and early 2021. When asked how the conversation is going between the ministry and airlines officials to resume flights, the minister says this.
So I spoke to a senior vice president of Air Canada just yesterday. Happens to be a friend of mine. And it seems as if the flights from Canada won't be resuming at least for another 30 days. Flights from the UK, I think it's probably a little bit later. I mean, British Airways has mentioned dates over and repeatedly and been unable to meet those dates.
Just like the Prime Minister and the Minister of Health, Minister Diagla is encouraging Bahamians and residents to take the vaccine to safeguard themselves and others around them. I'm Laurencia Smith for JCN News.
That said, the Consultant Physician Staff Association President Dr. Sabrika Pinder-Butler is sounding the alarm and says she hopes the team advising the Prime Minister would have looked at all of the factors that could impact the transmission of the COVID-19 virus in the country. These comments follow the announcement by the competent authority indicating that as of May 1st, international visitors and returning residents who are fully vaccinated and have passed the 2-week immunity period will not be required to present a negative RT-PCR test when traveling. JCN's news team reached out to the CPSA president, who says this.
We're dealing with something that's new to all of us. As you said, countries have halted vaccines. We know that even with surges, we've seen different variants come out and those types of things. And again, even with the vaccination campaign, I think everywhere has said to you that even though you're vaccinated, it doesn't mean that that will stop you from being able to transmit COVID-19, okay? And so I think that with those things, as a country, I would have hoped that we would still have been more cautious before we remove all measures.
As previously stated, those fully vaccinated may travel without taking that RT-PCR test. To that, Dr. Pinder-Butler says this.
I would have thought that some sort of testing would have still be in play, whether it's a rapid test or something, because we know that vaccination, although it may help to not allow you to have severe COVID illness or hospitalization, it still will not prevent you from necessarily contracting COVID. And so I think it is something that we have to pay special attention to, especially when we also found out that most of the cases I think that we saw were related to travel. So I think if we saw that, you know, as intelligent people, and I think Bahamians are intelligent people, we too now have to, you know, someone can make a recommendation and say what's happening, but I think as Bahamians and as responsible and intelligent people, we have to also be able to do things for ourselves.
Dr. Pinder Butler contends that with many of the recent cases related to travel, the testing measures should not stop. Within the last year, the country has reported nearly 10,000 cases. According to the National COVID-19 Consultative Vaccine Committee, more than 20,000 Bahamians and residents have been vaccinated to date. You're watching JCN News. Stay with us.